We have a volunteer group of nurses, respiratory therapists, pharmacists, speech therapists, doctors, people who want to be here, people who want to be part of this and want to fight this.
When Cone Health assembled its staff at its COVID-dedicated hospital,
it is the all-stars of nurses.
It was a new experience for every one of them. But for relatively new nurses like Cameron Howard,
I mean, it's baptism by fire for you.
Especially the past couple of months. I've seen a lot.
They work 12-hour shifts of pure stress, especially in the early days.
Because you didn't quite know what to treat or how to treat or even what to look for.
At first, they were dealing with mostly anonymous faces, but
as time has gone on, I've gotten a call, "Hey, Wakia, I'm a nurse that used to work with you. Do you remember me? I'm in your hospital."
Eventually, all of them become family.
Having COVID, your length of hospital stay is much longer than the average 2 to 3 days. So you do get to know them.
In a way that only the crucible of near death can.
You spend your day with people at some of the worst parts of their life.
Yeah, you know, we have developed relationships with so many of our patients because they're with us for a long time in the ICU.
Hayward Parker was there.
I've never been this sick before in my life.
4 weeks.
And when I was on the ventilator, my lungs started bleeding, and they called my wife and told her that I wouldn't make it through the night.
What goes through a wife's mind?
I was devastated. I would call with FaceTime. The nurse and doctors and staff were great. I would FaceTime every day and say, just put the phone to his ear, because I believe he could hear me so I could talk to him. I'm sorry, I'm getting upset.
Amantha Parker's husband was just 51, healthy.
I love you.
I love you too, honey.
But was so devastated by this virus that he had to learn to walk again. They never lost faith.
You know, no matter what the doctors say, I was still saying God has the last say.
Are you a changed man?
I'm definitely a changed man by this.
And are forever thankful to the medical team that saw them through.
This is an isolating disease. These people can't have visitors.
Yeah.
So when they get sick, they're on their own.
I think that we all feel like we're lifelines for our patients.
That's exactly what we become, is their surrogate family. You know, their family can't even be there to hold their hand. So I always tell them, I said, I know I'm not your family, but I'm gonna try and be the next best thing.
Difficult work, but in the end, there's no place they'd rather be.
We have one nurse that says, "How could I look back in 20 years and say, I sat this one out?"
This is something that our team will never forget. You know, I look forward to the day that I'm near retirement and I can look back and remember being part of this team.
There's a method to our madness.